Get started.
All right. Hi, everybody. Welcome to our March Optimizing Newborn Nutrition webinar. We are going to talk about measuring change and disseminating work today. We have Dr. Michelle Marie Pina with us. We'll have a couple updates and then we'll get into Dr. Pina. Next slide, Linda. Just an update again about the MPINC survey. It was launched in January. We encourage you to find who at your hospital the survey link went to and complete that survey as a team if possible. If not as possible as a team, just to encourage somebody to submit that from your hospital. We are at about 56% response rate in the last cycle in 2022. And we like to see that response rate increase just so we can have some really great data across our hospitals across the state. So if you have questions, that CDC MPINC email address is there. Next slide. And again, we are offering site visits this year. These are voluntary. We have been to some really great hospitals and met with some of you. So thank you for hosting us. We will be visiting Columbus, Piedmont Columbus at the end of March. And we would like to visit a couple more mother-baby units and NICUs this year. So if you're interested in showing us around your center, having us meet with your team, and we like to meet with your leadership. We interview kind of brief interviews with staff and patients. And at the end of the site visit, we turn around a report with some curated resources, the responses to a survey that we'll provide beforehand. It's been really great so far. So if you are interested in hosting a site visit, reach out to Claire Eden, and her email address is listed there. Next slide. Just wanted to remind everybody about the recorded webinars and the micro lessons that are linked like topic-wise with those webinars. So there are 22 that are posted now on Georgia Train. So you'll see those. We'll also put this in the follow-up email so you can kind of see this crosswalk of webinar titles with the micro lessons. There are 2 new ones that were just posted. So you'll see engaging partners and oral immunotherapy. Those are up on Georgia Train now. And the webinars are on the Optimizing Newborn Nutrition team, as well as on the Georgia PQC website. Thanks. And now I want to hand it over to Dr. Pina. Unfortunately, my computer crashed and I am on my phone, and so I don't have your bio in front of me, Dr. Pina, so I can't give you a proper introduction. I'm so sorry. I do want to welcome Dr. Pina back. You may remember her from our June of 2022 launch of Optimizing Newborn Nutrition, where she gave a really great talk on equity and quality improvement. We're happy to have her back now. She is joined as faculty at Emory and Children's Healthcare of Atlanta, and now as a member of the GaPQC neonatal committee. So we're very excited to have you, Dr. Pina, and I'm sorry that I'm going to have to not do your really amazing real intro. I blame technology.
No worries at all. I'm so thrilled to be here. Hello, everyone. I'm really excited to be chatting with you. Am I okay to share my slides?
Yep.
Okay, perfect. All righty. All right, so today I am going to specifically hold on, let's see if technology is my friend today. All right, hopefully you're seeing my first title slide. Is that true?
Yep, looks great.
Yes. Excellent, wonderful. So I'm really excited to be talking with you today about some QI methodology as part of our QI webinars, specifically on measuring change and disseminating work and building on the prior webinars that have been given to really get to the point of making change and sustaining change. And so with that, for today, I'm going to recap your last session, doing a brief review on the IHI model for improvement and PDSA cycles. And then the focus of today's lecture is going to be on sharing QI tools to measure and detect change. specifically about talking about run charts, and I'll dabble a little bit on control charts, and then talking about the value of dissemination. My hope is that we can make this somewhat interactive using this platform that we have, and I'll share some different tools that may allow us to do that, and have today be a fun session. And charts can be fun. That's hopefully one of my take-home points for you. And so to review our IHI model for improvement, we're starting with these 3 questions. So 1, what are we trying to accomplish? And we're using our smarting to answer that. How will we know if a change is an improvement? And we'll be using data to measure that. And you all are all doing your monthly audits. And then what changes can we make that will result in improvements? And that's when you're going to be testing your change ideas, your interventions, your countermeasures, whatever terminology you prefer. And during your last session, you talked about when you're talking about your change ideas, testing them specifically through PDSA cycles, where you have your plan, do, study, act framework. And then as Dr. Patel reviewed the last time, this is sort of a slide from his slide deck to just anchor us back into that mind frame and build off of that. With the plan part of a PDSA cycle, you're going to be stating your test objective, you're predicting what you think is going to happen, and you're going to develop your plan, your who, what, by when, where, what data you're going to use. You're going to carry out your test. It can be small scale, even just 1 patient. You're going to document problems, unexpected observations, and then you're going to study what you see. So you're going to analyze your data. You're going to summarize what you've learned, and then you're going to act on that. Are you going to adopt? Are you going to adapt, abandon? And that's all going to be based on what you've learned, and then you'll plan your next test. So with that, wanted to hear from you all. I want to hear what change ideas have you and your teams been working on. So we're going to use this for this platform called Idea Boards. It's a very simple type of platform. And what I love about it is it reminds me of those days when we used to meet in person and we used to all use our sticky notes and put things on the board. And so specifically with this board, I would love to hear about change ideas that your teams are working on. So there's going to be a section where you can share things that you have already adopted. So it's sort of part of what you're doing, things that you've adapted. So that'll be all in one section. In the middle, things that you've tried and you've ended up abandoning. And then all the way out to the right, things that you're planning for the future. And so the link is tinyurl.com/GaPQCCI. And hopefully it's also I'll put it also in the chat in case it's not there yet. And then to use this, what you'll do is you'll click this green circle with the plus sign, and it'll help you add a sticky. And so that is what will come, sticky will come up and you could just type right into it. Very easy to use, and you can add as many stickies as you want in the different categories. And then if you see something that somebody else is doing that you're also doing, you can also click on it and you can upvote it. And it'll be a great brainstorming tool, a great tool to share what everybody's working on all together. And so I'm going to stop sharing my PowerPoint and share this link so we can all see together what everyone is working on. We see is the link in the chat. Cannot get to the chat here.
Yes.
Yeah. Oh, perfect. Thank you so much. All righty. So I am going to share my screen. So I can get us started. Oh, all right. I love this. Okay, let's see. Let's see them come on in. So I'll give us 3 minutes. So it's 2:12 on my computer. We'll give us till 2:15. You can just add on. All right, for those that are joining us, there should be a link on your chat. We're using idea boards to add for people to share some change ideas that their teams are working on. And so you can share what change ideas your teams are working on, things you've adopted and adapted, things you've abandoned, and then some future ideas that you're working on. I'm gonna give this 2 more minutes. I'm loving some of these ideas, things that people are working on. All right, 1 more minute, a little bit less than 1. And submit your stickies. All right. Well, thank you so much for sharing. I love seeing so many different stickies. Before I go through them, I just wanted to share this as a tool. So this is a free tool. I have no stock in idea boards, but it's a really helpful, again, low-tech tool, especially in the era of virtual meetings where you can do collective brainstorming. And so it's easy to use. Hopefully you've seen now, and you can do this to collect feedback, to get ideas, to share ideas. You could even use it like as an affinity diagram for brainstorming, where you can cluster, and you can even bring sticky notes together and merge them. And so it's a helpful way to get people to share ideas, and it's a low risk because it's all anonymous. So I have no idea who shared which stickies. I appreciate all of you for participating. And so it's really great to see all of the things that you all are working on. It sounds like you've been very busy. So you can see here in the adapted section, and feel free to keep adding as I'm talking. You could see, I can make this a little bit bigger. People have expanded their donor milk criteria. We got an upvote here for that, for somebody else working on that. We've got someone with the inclusion of assisting with latching, hand expression, and utilizing the pump in competency, colostrum protocol for early feeding in the NICU, IBCLC modeling latch, and hand expression on L&D. You have a process to triage parents to receive skilled lactation care based on risk factors, helping increase access for breast pump referral to DMEs, including techs in breastfeeding education to help them be more successful in helping mothers with breastfeeding techniques and education, donor milk guidelines, so we can, it may be NICU specific, it may be also term or the nursery, but you see another donor milk change idea in the works. Abandoned, removing the focus on benefits of breastfeeding and focusing more on points like how milk production works and identifying feeding goals. Love that. And then you can see here in future items that or change ideas that people are working on, increasing their IBCLC staffing to meet guidelines, awaiting approval for IBCLC position in the NICU. And we have 3 upvotes for that. Seems like a lot of people are working on that. And it's helpful to hear that, right? Because I think if a lot of people are working on increasing staffing, I'm sure that a lot of people are facing similar barriers. So, having us all aware of that might help us, all find ways to, if we're having similar challenges, and how do we justify more IBCLCs for our units? Can we learn from other units? Is there a way that GaPQC can facilitate conversations between people working on similar change ideas? Sending nurses for a CLC certification, extra training for night nurses on what to do when supplementation is requested, working out an on-call system, scheduling for later hours of the evening when lactation staff's on site. So great. Thank you all for sharing. I don't know if the GapQC leadership has anything else that they wanted to share or any reflections that they wanted to share. I don't know if you can hear me. Hopefully I'm talking to there are people still here.
Yeah, we can hear you.
Dr.
Those are
Pena,
great. I'm recording these for future reference.
Perfect. Wonderful. Well, it's
does
great.
the board save so that we can come back to these if we don't capture all of them?
Absolutely. I can export it and share it. And certainly we can find ways to share them with the, as part of the recording, and also through GapQC to share all of these change ideas people are working. So I'm going to stop sharing and go back to the PowerPoint. So thank you all for sharing. So since you are already working on so many different change ideas, you're going to start getting to you are probably already thinking about how will you know if you've made an improvement. And I love this cartoon where there's the dinosaurs and there's data, and then this other dinosaur is like, I'll just trust my gut. And we all know, potentially how that went. Anywho, and so ideally, we will know if you've made improvement using data. And specifically with QI, we're going to be using charts. And specifically, we'll talk about run charts. So with that, I'm not sure if the poll feature is going to work. We can give it a try. I saw that it's been enabled. There's going to be a little pop-up of a check mark and an X come up. Have you ever created a run chart or a control chart yourself? See if this works. You can press a checkbox or the X. And you can see on the chat also another cool tool that you can use on Teams where you can see the vote, and this is an instant poll, so you can just do it right as you go. So you don't have to pre-populate it with anything. You can see here, we'll give you another minute to submit your vote. We have 12 submissions, and it looks like we have 33 people, so we need some more votes, everybody. Low stakes. I have no idea who's clicking what. All right, we got some more answers. All right, so it's great. So we have some people, we have four people, so 28% answered that they've had some experience with creating their runner control charts. And it looks like the majority of us, so 73% or 11 people have not had experience in creating them. And so you're in great company. We can all learn from each other. All right, so then looking back at our next poll, I will become smoother as the polls go on, I promise. So the next question is, have you reviewed the run chart of your center's data? So you should be receiving Excel files with your center's data that are put in a chart. Have you yourself looked at those data? So if we can start that poll. All right, we have 16 responses. Can get a few more. Can we get to 20? All right, we're at 17. 3 more people want to share whether, again, we have no idea who is answering when. Oh, it looks like one person can't submit. I'm so sorry, Dr. Humquist. We will work on figuring that piece out. Hopefully you can see some of the responses in the chat. You can see here we have 8 people responded, so 44% have seen their data on the chart through the run charts that are being supplied, and then 55%, so 10 people have not. And that's A-okay. That's part of the reason why we're having this meeting today. So you know that you have access to that, looking at your data in this way and learning from your data. And then the next poll, this is the third poll. Have you disseminated your charts outside of your stakeholder group? So we'll give you a minute to answer there. So have you disseminated your data outside of your stakeholder group? All right, looks like we have 12 responses. Let's see if we can get to 15. 13, 2 more responses. All right, looks like we have 38% have shared their charts or their data outside of their stakeholder group. And then it looks like 61% of folks have not. And we have also some participation in the chat. So thank you so much for those. Apologies that you can't access the chat. We'll work on that for the next time. So with that, that's helpful to know, and we can see that we have a little people that are in different points of their projects, different points in their data, and that is to be expected. So the goal of really today is to meet you where you are. So whether you have looked at your charts, whether you haven't, the goal of today will be for you to familiarize yourself with run charts, so that then you can now look back at your center's data and look at your charts, and you'll have a little bit more knowledge, hopefully, and a little bit more perspective in how to interpret the information and then talk about disseminating it. And so when we're talking specifically about run charts, I love run charts because they're a really nice way to show your data over time. You'll remember when you were in school, we did a lot of pre and post like bar graphs, where you have these 2 periods of time and you're showing before you did something, this is where you were, and after you implemented something, this is where you ended up. And it's very limited because you don't know what happened in between those 2 points. And so what's nice with run charts and what's nice about QI is that you're looking at data over time. Run charts specifically are very simple to create, and they're based on the median. That's the center line that you'll see. And so just to recap I had to refresh my memory when I first started doing run charts again. Your median is really going to be when you have a data set, the middle of the data set. And so let's say you have 5 points, you put your data points in order. So smallest to biggest, and then the middle number is going to be your median. And then if you have an even number of numbers, so let's say in the next example, you have 6 data points, the middle of the data set is 2 data points. So in the example here is 4 and 5. And so you'll do the average of those 2 data points, and you'll see that your median for that data set will be 4.5. And so the nice thing with run charts is that you can start run charts as soon as you have data. So you have 1 data point, you can start your run chart. And so this is what run charts will look like. And you've received templates to create your own, and then you've also received your center's data. And so what's nice about a run chart is, sort of to orient you, you have your x-axis here. So you have your audits that you've been doing. So each month you have your audit, and then you have the percent of infants. So you're auditing 10 babies every single month, and you're going to have a percentage of babies, and this is specifically for formula supplementation. So you'll have a percent of babies that are receiving formula supplementation. And each blue dot is the data point of the data that your team collected for that specific month. And then you can use these data to create your center line in a run chart, which is a median. And you can see not only your data points, so your data points are in blue, but then you can also see you have this center line to give you a sense of where you are as far as your baseline goes, or what you're comparing to. And so specifically for this chart, just to remind you, formula supplementation in the last week, lower is better. And so you can get a sense of where your data points are, and what your median is for the data that you have. And so you can start run charts truly from just one data point. You can start plotting and start learning from your system. And so when you're talking about baseline data, you want to have some baseline data before you start, ideally before you start making changes, to know where you're starting. To know where you're starting, are you starting in a place where you have a lot of room for improvement? Or are you starting in a place where you are already in a place where you have, you're in a good spot? And, once you're in a good spot, then you have to work on sustaining your improvement and knowing why you're in a good spot. And so in run charts, you'll see this, like I said, the red line in the last chart, we call that the center line. And that in run charts is your median. And in run charts, ideally, you'll calculate your median when you have 10 points. So you can apply rules that I'll go on to in a minute. However, for each initiative, like I said, start with what you have. So whether it be data from your audits, or if you have the opportunity to look back on your historical data and pick 10 babies from, each prior month, and see if you can even start creating your center line from that. But you certainly don't want to start improving, and you don't want to start doing the work because you're collecting baseline data. And so I wanted to show this mock-up. Your team should have received the template. The document should be called Run Chart Template. The nice thing with run charts is you can also make them on Excel. And like I said, if not, the GaPQC team is also providing it. But just to show you what goes behind it. So this looks at your data for audits, for example, and this is all populated for you. The denominator is already always 10 because you're doing 10 baby audits every month, and you have your data points for each month. And then the template's already populated, so it creates a percentage, and then you can calculate your median based on those 10 points. And then the template is set up so that it will actually create a run chart for you. And so this is really just to show you how simple it is to make a run chart and how you can make it in Excel and plug in the information that you're already collecting. And so the main thing that run charts help you with is to distinguish signal from noise, because you really want to know, have you improved? And when I'm saying signal and noise, so when I'm saying noise, I'm talking about things that happen naturally, natural variation, they're inherent. You'll hear some people say common cause variation in some situations. And what we're looking for is there actually a signal? So is there something that's like unnatural variation, something that happened to the system that caused special cause variation that's not part of the usual process? And with your QI work, what you're doing is you are introducing changes. And so the goal is that those changes are going to cause signals that will hopefully improve your system. And so you could have situations that are planned. So let's say you are implementing, like we talked about, a new donor milk policy. And so you can have a signal potentially after you tested that. Or you could have an unplanned situation where, for example, you could have, in the outside world, there's a formula shortage, or you could have COVID, or you could have some other unplanned situations happen. You could have lactation consultant staffing issues, for example. And so you always want to have a sense of what the context is as you're interpreting your charts. And I'll talk about when on your chart something looks like a signal in a minute. And so I bring up those terms because the goal, like I mentioned, with a run chart is you're going to look at your data over time, and you're going to try to identify whether some non-random signal is happening. So whether there is sign that there is a change. And there's specific run chart rules that have been created to identify whether there's a signal. Some of them are based on visually whether it looks like there's a change, and some of them are based on statistics. So one of them, the first one, is whether or not there's a shift. And so this first rule is whether there's 6 or more consecutive points either above or below the median. So you can see again, this is a run chart example. You have your time on the x-axis, your measure on the y-axis, your median here, that straight line, and then all your data points. And you can see here there are 6 points above, and there's 6 points, even just having one set of 6 points above or below, that would be that would qualify for a shift. And basically that's just saying that for 6 consecutive points to be above the median, like that's more than just by chance. There's a possibility that something non-random is happening here. The next rule is whether there's a trend. And so a trend is whether 5 or more consecutive points are all going up or all going down. And these pictures are showing examples of both, but you don't need to have both. A trend, this is a trend, and that would be enough to make you wonder whether there's a signal. And important for this, like values don't make or break a trend. So if you have 2 points that are exactly the same, that doesn't count in the 5 points. And so a trend is another rule. And then this next rule, it's called the runs. It's the runs. And so you can see when we talk about runs in run charts, we're talking about the number of times that data cross the median and you add 1. So when you look at this example chart, so these are all the data points. This is your median. You're crossing your median only 1 time. So number of runs is the number of times crossing the median plus 1. So the runs for this chart would be, for example, 2, right? Because you have 1 time that you're crossing the median plus 1, like you see here in this equation. And so there's statistically, there's a table that then you can use to determine whether for all of your data points, you have an appropriate number of runs. And so you usually need to have at least 10 points. And, so for this chart, you have 10 points. You can count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 points. And then when you find the number of points, you can then know how many is too few runs or too many. So we know that the lower limit is 3 and the upper limit is 9. And we know that for this chart, for example, we only have 2 runs like we calculated, and that is below the lower limit of runs. So we would say, hey, that is too few. And that would be a sign, like that would be a sign for a non-random signal. And that would make you wonder, like, why do we have so few runs? And when you look at this, even visually, if you look back, it's because it kind of looks like things are improving. You went from having everything underneath the median to everything slowly being above the median. And so that would be a point for you to think, okay, this actually could be a signal that you're starting to see improvement for this particular case. And you sort of take it case by case. It basically just tells you that there's something different happening. And then this 4th rule is astronomical point. So you can see here that there's all these data points, and then there's this 1 point that just looks really far from the rest. And so this would be one of the 4th rule, which is the astronomical point. And so to summarize, you have these 4 rules in run charts that help you determine whether there's non-random signal in your run charts. So whether there's a shift, so 6 or more points above or below your median, whether you have a trend, whether you have too few or too many runs, and then whether you have this astronomical point above, like far from the rest above or far from the rest above. And so you may be wondering, I met a rule, now what? So again, these rules are trying to tell you that there's something that's non-random happening. It's not that you just have this up and down happening. You have something is happening in your system where it's not just random things happening, but you have this signal that actually there's change potentially happening. So whenever you meet a rule, you first want to, take a minute and say, is this because things are improving, or is this because things are worsening? You want to have a sense of what has been changing in your system. Is this expected? Is this unexpected? Is this intended? So are you testing in a PDSA cycle, or is there something else happening? You want to understand what's happening with your system so you can determine whether or not you can shift your center line, which basically means you met a rule, you can explain what happened, and you think that with this change, it's probably going to keep with that new baseline. And so when we say shifting a center line, we mean that you can recalculate your median for a run chart. And the reason why you do this is because if things have changed in a way that things are better, for example, you want to then compare the future data points to that new improved baseline. So here's an example. So let's say you have this formula supplementation chart. Again, this is a run chart. You have your month of audit on the x-axis and your percent of infants on the y-axis. You have all your data points here in blue. You have your median line in red, which was 60%. You hired a lactation consultant. You had an additional lactation consultant in July of 2022. And here, just to orient you, formula supplementation, so lower is better, or lower is the desired direction for this chart. And so you have this change, and then you see here that you actually meet a rule. You have 1, 2, 3, 4, 5, 6 points below the median. Remember, the ones that are on the median don't count for a shift. And so you're like, oh gosh, I met a rule. And actually it makes sense because I hired this lactation consultant, and with that, I'm seeing this change. So with that, you can actually recalculate your median, and you could see here, you can recalculate it using those data points, and you could see that your center line went down from 60%, and you have an improvement now with your center line at 30%. And so that's how you're using these rules. You're using the rules to identify changes, to understand variation, understand changes, find what it is what's changing in the system, and then use that all together to see whether or not there's change, and reflect that in your charts. And so when you are looking at your charts, it's really helpful to use your charts to tell a story. And you could even summarize an entire project with a chart. So again, this is a formula supplementation chart. And you could see here, like I've been going over with every chart, it's helpful to note what kind of chart it is. It's helpful to label your axes, to say what your center line is. So you can put center line, you could put median and put the number in, it's helpful. To put the desired direction for improvement. You can also even put a goal line, is really nice to also include. And then to also annotate your charts with the PDSA cycles and change ideas that you're testing. And so with just this, you can somebody can look at this project and get a sense of what you've been working on and what you're doing. And so with that, to be able to create an annotated chart, it's really important to keep really detailed notes throughout your project. So you want to keep documentation for how you calculated your baseline, what change ideas you're implementing and what change ideas you're testing and implementing, what your observations are. Write down, our grading team knows I'm very neurotic of making sure to write down dates for all the things that we're doing. Because again, and this will be critical as you are annotating your charts. And so that is sort of a whirlwind review of run charts. I was just going to spend 2 seconds just giving a quick overview of control charts, but I want to take a pause there and see if folks had questions or thoughts that they wanted to share. If not, I can keep going and we can save it for the end. I can't exactly see the chat, so if there is something in the chat, if I can have somebody please read them off. All right, we can save it for the end. A few words on control charts. You may have seen some control charts. I would say run charts are a great way to start your project, and you can use run charts for a long time, and you could use it for all of your project. Control charts are a little bit more statistically rigorous, and they are preferred to understand variation, and it can be really helpful, especially if you have more data points. And so when you have at least 12 points, you can already start trialing out a control chart. And the reason why control charts are preferred is because they're based on the average. So the center line, remember the center line for a run chart is a median, whereas the center line for a control chart most of the time is an average. So it's much more sensitive, especially like an average is much more sensitive to like outliers, for example. Because remember, a median is just putting numbers in order and picking the middle one, the middle number, whereas an average is taking the breadth of all the data into account. The nice thing also with control charts is that you can also have, you can also include things called control limits. And you can think of this kind of like with statistics where you have your average and your standard deviations. Your control limits are kind of like standard deviations. And your upper and lower control limits are like plus or minus about like 3 standard deviations. And what's really helpful with these control limits is it'll give you a sense of whether or not your process is stable or not stable. And then control charts can get a little bit tricky, complicated, I will say, because there's lots of different types of charts depending on your type of data. But they are really fun and really cool. And they're very operator dependent. Certainly when I started my control charts, you got to pick the right chart and have your data inputted the right way to be able to use them correctly. And so just a quick recap. And again, I think I have a lot of projects where I've focused specifically on the run charts for most of the project. And I think run charts are just very easy and quick to use. And so I'm a big fan of them. And so just to compare run charts and control charts, I have this table here. So your center line, you have your run chart is typically your median. Your control chart is typically your mean, your average. For your run chart, you typically need less points. You can start with any number of points that you have. You start calculating your center line when you have at least 10 points. For your control chart, you could start playing with control charts when you have at least 12 points. You can do like a trial control chart and then you'll lock it in once you have 20. Run charts don't have control limits. As you remember, it's just the line of the data points and your median line. And then your control charts will have these upper and lower limits. Run charts are less sensitive to outliers because remember, it's based on the median, so just that middle number or middle average. And then control charts are much more sensitive because you have those control limits. Run charts there's really mainly run charts that we'll talk about. It's like one type of chart, whereas control charts will have several different types of charts depending on the type of data and the type of events. So whether it's discrete data or continuous data, rare events, common events, there's different types of charts for each situation. And then the rules, I will say, are also different. So we went over 4 rules for run charts, and those are specific to run charts. And those are based on the fact of that they're statistically based on the median, and also on like sort of visually what you see looking like change. Whereas control charts have specific rules that are based on the average. And so these are the specific rules for control charts having non-random signal or special cause. We'll use that language more for control charts. And these will be shared when we share this slide deck. And so all that to say, when we're talking about charts, it can feel really intimidating at first. And I totally feel that, but hopefully these slides and this discussion has communicated that these charts are really tools. They're meant to help you see your data, help you understand your data and understand your system, and give you some rules to learn whether something's random or something's different happening that's a change. And so these tools should help you, not be a hindrance. And just know the best thing you could do is just start looking at your data. The charts don't have to be perfect at all, but at least start playing with the data and start like making hypotheses and observations about what you see and what you think is happening with your system. And so with that, I wanted to spend these last few minutes talking about dissemination, because we have our stakeholder group and we have our data collection and we create all these charts. And I will say the default is usually for us to talk about these charts in our own little groups. But I wanted to spend a few minutes to talk about dissemination. And it sounds like some of you all have already started thinking about this. And I like this cartoon where it says the person says, "Nice, email sent, dissemination complete," and then the person that's receiving it is saying, "My spam folder is out of control." And so with that, we're going to do one more idea boards, and we'll give you like 3 or 4 minutes to share. And so if we can put this in the chat, so it's tinyurl.com/GaPQC disseminate. I want you to share how you are or how you're planning to disseminate your charts and your local work with your unit or your division, with your sort of the hospital-wide kind of dissemination plan, if and how you're planning to think about disseminating with patients in the community, how you're planning to share things beyond the hospital walls, more regionally, nationally, and then some worries you have about dissemination. And so I'm going to, again, just to orient you in case you missed the tutorial, you press the plus sign to add a sticky note and you just type in your answer and you press enter. And then if you want to upvote one, you can click on the sticky note and put a thumbs up. I'm going to stop sharing and open up the website so you can see people doing live. And again, this is all anonymous. Give us 2 more minutes. And again, these can be plans. So even if you haven't disseminated yet, your team's work and your data, you can also share what your plans are. Okay, we'll give you 1 more minute. All right, if you submit your last ones, I'll start going through. So you can, it's great to hear people already brainstorming and starting this process. And I'll share a little bit more about why. And it seems like I'll be preaching to the choir, as many of you have already started to think about this. So you can see here with thinking about this, I think one point that I want to make by making these different buckets is to think about dissemination plans to your different audiences and not, just your unit, but also thinking about the different levels of dissemination. So it looks like here folks have been sharing with their unit and their division during their weekly updates that are sent to staff. So I'm assuming this is through email, and we have an upvote here. We have daily huddle staff meetings, unit practice meetings, communication boards, hospital administration meetings. So it looks like this has sort of been incorporated into all the dissemination processes for that particular unit. We have clinical team meetings. And then we have here in this next sticky note a lot of similar thoughts. So staff meetings, email, unit practice council, women health service leadership meetings, perinatal practice council. And then with the hospital, we have leadership council that meets once a month and data can be shared there. CEO shared work during hospital leadership meetings. So it's great to keep your hospital administrators and leaders in the know on these efforts and where there's room for improvement as well, because you'll need the support. With patients and community, can be shared during childbirth classes on social media, absolutely. Shared with clinic, patients, families, AAP, application of PCMH approach, clinic website, regionally and nationally, folks shared, sharing with groups of hospital in their system that are actively participating in the initiative. Absolutely. I would argue you can also share it with hospitals that are also not involved in the initiative. It may actually get them curious and want to engage. Also sharing during regional get-togethers amongst local hospital leaderships, submitting as a bright spot to GaPQC newsletter. And then I think it's always important to think about what are your worries or considerations about kind of like balancing measures of dissemination. And so what if our charts don't show improvement trends? I think that's a real worry. What if our numbers are not what we want them to be? How will the community respond to less than stellar data if other hospitals are improving or excelling? And these are real challenges, and you are not alone in those concerns. And that's where I think forums like GaPQC are helpful, where people can share how they've thought through these challenges. This is also a place, these concerns may also motivate you to also engage with patients directly, even in your stakeholder group, to give you feedback and give you their thoughts on how you could disseminate this work in a way that's productive. And also that's so that they can contribute to the work. So thank you all so much for sharing. This will be something else that we can also share with the group at large. I'll export this after. So then just a few quick points, since pretty much everybody said all that I was going to share on dissemination. Let me just get to my PowerPoint. So why? So why disseminate your work? So one, to get feedback. So from feedback from your local stakeholder group, also to get feedback from people that are not in the stakeholder group. It's really helpful for people to know that you're doing this work and get their perspective on the data as well. To improve engagement, again, within your local group, to see how the work you're doing is making an impact or not making an impact. And then also to engage others who may have opinions or a stake that may not be included. And then also to improve inclusion. You may notice that, for example, if you're not making a change, maybe you need an additional perspective, or maybe you need an additional expert, and maybe you need more input. And so I think dissemination helps with inclusion. When can you start disseminating your charts, for example? When they're updated. If you're nervous about whether they're correct, certainly rely on GaPQC. We have a lot of people that are very expert in QI. And then also relying on people in your hospital. When you have a message, when it's understandable to the intended audience, especially when an initiative is a unit priority. And then all of these ideas were pretty much all reviewed in the breakout activity. And so certainly want to give a plug for our GaPQC webinars, but we talked a lot about our staff meetings, email updates, bulletin boards, huddles, quality conferences, department and hospital leaders. And then also, let's not forget about the importance of disseminating to parents. And so with that, I think hopefully you leave today energized to look at your data, to learn from your data, and disseminate your data when you're ready. And so some take-home points: run charts display data over time, and they can help your team distinguish signal from noise, and they're meant to be a tool. Dissemination is critical. You can routinely review and share your charts with your team, your stakeholders, and other forums. And that to please remember that QI is a team sport. You're not alone. Lean on your team, lean on QI experts, including the GaPQC team, to help you and support you. In case you're interested in learning more about QR charts, these are two really helpful resources. The Memory Joggers, like a smaller book, and it's less expensive. You can buy these books anywhere. Books are sold. And then the Healthcare Data Guide, this is the new version. It's a little bit pricier, but also another helpful resource. And so one last poll: do you think it would be helpful for GaPQC to have QI office hours? We can just open that very quickly. We can open the last poll. Again, the question is whether you think it would be helpful for GaPQC to have QI office hours. It's looking like an overwhelming yes from our N of 10 so far. And so it's certainly, and looks like we have some input and through the chat as well. And so it's certainly something that we can bring back to the team. And so with that, I want to thank you all for your attention and your time. And again, run all these charts. This is not the only time. If this is the first time, this will not be the only time. This is the second or third time. It should not be the only time you learn about run charts. The way you learn a lot of these skills is by practicing using these data and manipulating the data and sort of analyzing the charts. And so I'll be sure that these slides are disseminated, are disseminated so that you can use them to review. And here's my contact information in case you have additional thoughts, questions, reflections, feedback. My son here, home with fevers, also enjoyed putting this presentation together with me. So thank you all so much for your time, and I hope you have a great afternoon, and I'm happy to stay on for a little bit longer for questions and thoughts.
Thank you, Dr. Pena. That was excellent. Are there questions from folks? You can put them in the chat, or you can come off mute and ask your question. We do have a couple final updates. If you're thinking of your question or if you're typing it in the chat, I'll go through these quickly. A reminder about the Emory Conference on Breastfeeding. Pre-conference workshop is April 10th, and then the conference is the 11th and 12th at the Emory Conference Center. I have some more information on that in a second. The GaPQC annual meeting is April 25th and 26th, also at the Emory Conference Center. The March audit will be out on March 25th. So data leads, be on the lookout for that coming from Linda. And there's no April webinar. We encourage you to join us at the GaPQC annual meeting. In the May webinar, you'll see a new face leading that. We have had a new team member join us at DPH. Laura Patillo is the new Neonatal Quality Improvement Senior Manager. She'll be leading the Optimizing Newborn Nutrition work on the DPH side. And so we're excited to see her. So you'll see her in May. Well, she's on right now too. You can see her now. She'll be leading the webinars going forward. Next slide. So the Emory Conference on Breastfeeding, again, a reminder that we are excited to have a GaPQC scholarship this year. This gives you 75% off the registration price, which is incredible. And the early bird ends this Friday, March 15th. We will put the link there in the chat. It's also going to come out in the follow-up email. The way to get the code to get the 75% off discount is to fill out the form that's there linked in the chat. That will go to Emory. Emory will respond, send you an email with the code. So if you're interested in that, the discount there for the Emory Conference on Breastfeeding, make sure you fill out that form. And again, try to register by Friday because the early bird pricing ends then. And then next slide. The GaPQC annual meeting is April 25th and 26th. Full day on Thursday, half day on Fridays at the Emory Conference Center. We do have CME and CNE credit available for attendees. Our early bird pricing goes until April 12th. So please register. That QR code there will take you to registration. We can also put that registration in the chat and it'll be in your follow-up email. Please go ahead and register. You do have to pre-register. You can't register on site. And you have to do that registration before April 17th. So if you just go ahead and get that done, you can check that off your to-do list. And then next, finally, please make sure you scan this QR code. If we put the link in the chat as well, this shows your attendance for this month. And that is it for us. Thank you, everybody. Have a great afternoon.